In Kaduna State, Governor Ubasani has restated his administration's resolve that health care for residents remains a right, not a privilege. He was speaking at the unveiling of the State Emergency Medical Services and Ambulance System to deliver swift responses to medical emergencies across the state. Lupe Assam has more.
The launch of the Kaduna State's Emergency Management Service and Ambulance Systems at the Doramila Secretariat marks what the government describes as a turning point in healthcare delivery. The system features fully equipped ambulances stationed across the state, a 24-hour emergency and dispatch center, and trained medical personnel. Through the state's rural emergency ambulance and medical services, even remote communities will now have access to life-saving interventions. Governor Ubasani says for Kaduna residents, healthcare is a right and not a privilege. The governor also highlighted the implementation of new salary structures for health workers designed to boost morale and motivation.
We are closing the access gap, reducing avoidable deaths, and strengthening public trust in our health system. This initiative supports the goals of the Basic Healthcare Provision Fund, particularly maternal and neonatal emergencies in underserved areas. Key milestone in administration has been the approval and implementation of the 2024 CONMES and CONHES salary structures. And I'm happy that you are also going to double on our effort to protect life and ensure that we give you our best.
This gesture had last week attracted huge praises from health workers in Kaduna.
This decisive move ends over a decade of stagnation in medical workers' remuneration.
On Wednesday, the governor inspected the nearly completed Mando Primary Healthcare Center, one of the 255 primary healthcare centers his administration is upgrading across the state. He interacted with staff and patients, assuring them of improved access to affordable healthcare through additional personnel and modern equipment.
I'm here to see the progress in our primary healthcare center, the one here in Mando. And healthcare for us is very critical because in Kaduna, healthcare is not a privilege. It's a fundamental right of our citizens, particularly the poor people, the vulnerable and underserved.
The flag off, he said, represents a covenant with the people of Kaduna State that no one will be left behind in accessing quality health care. Lupe Assam, TVC News, Kaduna.